Wonderful. Okay. Hi, everyone. Welcome. I see we're coming at 12, so I'll just get us started. So my name is Claire Keenan. I'm a research associate with the Maritime Spore Support Unit, the MSSU, and your host for this afternoon. If you're not familiar with the MSSU, we're one of 11 spore support units across Canada that support and conduct patient-oriented research. We work in all three maritime provinces. I'd like to start by offering a land acknowledgement that reflects my location here in Chibuktuk or Halifax. I'd like to begin by acknowledging that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which Mi'kmaq and Wolastoqiyik people first signed with the British Crown in 1725. We are all treaty people. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for the last 400 years. Many of you are joining from other parts of the country, so I'd also like to invite you to add a land acknowledgement to the chat, sharing the lands where you live and learn. So before we dive in, just a few housekeeping notes. Please keep your microphone muted. The session is being recorded and will be available on our YouTube channel afterwards. Closed captioning is also available, so please make use of them as needed. Finally, we'll be having a brief question period at the end of the presentation today. So please type your questions into the chat as we go and include your name if you wish to unmute and ask it yourself. Otherwise, I'll pose it to our speakers. So I'm very pleased to welcome you all to our webinar, Accessing Data. We'll be learning from many of my wonderful colleagues today, and I'll keep introductions quite short just to keep as much time as possible for our presenters. First, we'll hear from Caitlin Frizzle, Data Navigation Manager at Health Data Nova Scotia. Then Megan Pike, Data Transfer Coordinator, and Afton Levine, Data Access Coordinator, both from Data NB. And then turn it over to Robin Kidd, Senior Research Scientist at the UPEI Center for Health and Community Research and Manager at CIDR, and Alex Ouedraogo, Data Scientist at CIDR. So without further ado, I'll pass things over to Caitlin to get us started.
All right, thanks, Claire. So today I'll be talking a bit about how to access data at Health Data Nova Scotia. Next slide, please. So Health Data Nova Scotia, or HDNS, acts as an agent under the authority of the Department of Health and Wellness in Nova Scotia. So this means that Department of Health and Wellness are the custodians of the data, and the data custodians are defined as individuals or organizations who have custody or control over personal health information. HDNS is a unit of the Department of Community Health and Epidemiology at Dalhousie University, and we were first established in 1993, so we've been around for a little while there. We're also closely partnered with the Maritime Spore Support Unit as the partner data center in Nova Scotia, and we're a member of Health Data Research Network Canada, or HDRN Canada, and Robin will speak a bit more about that organization later in the presentation. So our main commitment at HDNS is to facilitate research and innovation in Nova Scotia by providing access to linkable administrative health data and analysis for research or health services assessment purposes in a secure and a controlled environment, while also respecting the privacy and confidentiality of Nova Scotians. Next slide. So I won't go through everyone's role here, as our bios are also listed on our website, but I just want to highlight the wide range of expertise on our team. And we also come from very different backgrounds as well. So backgrounds like computer science, statistics, and then nutrition, animal science, psychology. So we have a wide range of backgrounds on our team. Next slide. So I'll just briefly go over our main databases here. So we have our physician billing data, and then we have our hospitalization data, which is held in the Canadian Institute for Health Information Discharge Abstract database. We have day surgeries and very limited emergency department data in the CIHI National Ambulatory Care Reporting System. And then we have our 3 drug databases. So we have information on drugs for those enrolled in community pharmacare and seniors pharmacare. And then we also have our drug information system, which contains prescriptions that were filled in community pharmacies across Nova Scotia. Next slide. And then we also have our insured patient registry and licensed provider registry, which contain a lot of demographic information on Nova Scotians and on providers in Nova Scotia. And then we have our vital statistics death data. And then we also have provincial research databases that are our most recent databases. So those are the Canadian Longitudinal Study on Aging, and then or CLSA, and then the Atlantic Partnership for Tomorrow's Health, or Atlantic Path data. Next slide. Okay, so here we're going to get into the data access process. So at the beginning of the project, the researcher will usually contact HDNS first to discuss their project and how we can help. This can be done via email if the request is pretty straightforward, but it's also recommended to set up a consultation with a data navigator if they're new to accessing data, or if the request is complex and requires a more in-depth feasibility review. The research team should also become familiar with the HDNS data dictionary, and I've added the link there. That data dictionary site it shows all of our databases and variables available for request, including their field values. So for example, a variable could be location, so where the visit took place, and then the field values would be like office, hospital, etc. So all that information's there. And then we also have been updating a concept dictionary, and that will be available to help researchers define specific derived variables such as comorbidity indices. And then I've added a note here that the data access process is different if you're requiring data from more than one province, and we'll talk about that a bit later in the presentation. Next slide. So the next step would be to submit the feasibility and cost estimate form. So this form outlines things like the description of the study population, if external data will be linked in the project, which databases at HDNS are required, and whether or not HDNS will be performing the analysis for the project. And then once completed, this form is reviewed by a senior analyst at HDNS, and they will determine how many hours will be required for each part of the project. So things like cohort creation, data extraction, and data analysis, if that's required. And once that form's submitted, we'll send back a letter of feasibility, and that will outline the cost breakdown for the project, and that can be used to apply for funding. Or if the researcher already has funding, then they would just go on to the next step. Next slide. So the full submission to our data access committee would contain the completed data access request form and accompanying appendices. It would contain a full research ethics board submission and a research proposal or summary. So the DAR form, or data access request form, is the largest form we have at HDNS, and it requires a lot of detail. So for example, I've added the template table here, and you'll see what we expect each variable to be listed, and the justification provided on why that variable is required for the project and why that level of identification is required. So this helps us identify things like whether date of birth is actually required, or if we can derive age and just provide that instead. So although our data access committee requires a full REB submission, it's not required for us to provide a data access approval. So sometimes it's better to apply to the data access committee and REB at the same time, as a DAC may require changes to be made to the REB submission. And some REBs now require HDNS approval before they will approve a project. So in this case, the applicant needs to apply to HDNS before they submit their REB, but we still need to see that REB submission, whether it's submitted or not. And if you're ever unsure of what to do next, you can always contact a data navigator or anyone at HDNS to determine next steps. Next slide. So here I've added some common tips and tricks for a successful submission. To start with, it's highly recommended to become familiar with the databases and their variables, as I previously mentioned from our data dictionary. If you're not sure of anything while completing a form or the variable list, you can always send incomplete forms to a data navigator for feedback. We can usually review them within a couple of days and send back some helpful suggestions for that form. It's also recommended to have clear objectives and detailed methodology so we can help determine exactly what variables you'll need for your project. And then I've listed some common mistakes. So there's a question in our data access request form that's asking what risks there are to using the data and how those risks will be mitigated. Sometimes people will say that there are no risks to using the data because it's de-identified data, and that's wrong. There's always a minimal risk of re-identification. So that's why we have rules like not allowing cell sizes less than 5 to be reported and requiring anyone accessing the data to take annual privacy training and sign a confidentiality agreement. Another common mistake is not providing enough justification on why consent wasn't obtained. The most common response here would be that it's impracticable to obtain consent, and impracticability is defined as a degree of difficulty higher than inconvenience or impracticality, but lower than impossibility. So a common answer there would be that the sample size or the study population is too large for researchers to go out and obtain consent from everyone. And then another issue would be not listing all the variables required for the study and improperly describing how the data will be linked or accessed. So I've added our linkage diagram here that we usually use, and it follows a two-step process. So no direct identifiers are ever sent to HDNS. Only encrypted healthcare numbers or encrypted provider IDs should be sent to HDNS, and that encryption takes place at Medivy. Next slide. So the responsibilities of the Data Access Committee center around protecting confidentiality of personal health information at HDNS and the privacy of the individual who is subject of that information. Our DAC membership is diverse, so it includes about 14 members who have expertise in different areas such as privacy, implementation science, and biostatistics. And this includes representation from Department of Health and Wellness, Nova Scotia Health, and Data MB. We also have two public patient partners on our committee to gain insight from the public perspective on these data access requests. So decisions of our DAC are made by consensus and the quorum is 50% of membership present. If a project is considered minimal risk, then the DAC chair and another member would review that request. And we meet on the first Wednesday of every month. And prior to these meetings, we ask that the submission be sent 2 weeks in advance for preliminary review. And then we would send materials to everyone on the committee 1 week before that meeting. And we also ask that the PI or someone from the study team attend that meeting to provide a brief overview of the project and to answer any questions that committee members might have. And then these questions are summarized in a clarification request. And after the meeting, we would provide that clarification back to the researcher to revise the data access request form. Next slide. So once the revised DAR form and accompanying appendices are resubmitted, we would approve the project and send out an approval letter asking that the PI send us a signed copy of that data access request form, and then their REB approval when they obtain that, and then they would also need to sign a contractual agreement for data access and management. And then the PI and anyone accessing data would need to complete the privacy training, sign a confidentiality agreement, and send us their CV as well. And then once all those regulatory requirements are in, HDNS will place the project in a queue or begin working on it right away, depending on the wait list. And then the analyst would complete a project charter to outline the work they will do on the project. So things like cohort creation, project deliverables, payment agreements, and things like that. And then this would be signed by the project PI and HDNS manager, and then the analyst would begin working on the data extraction. Next slide. So once all that data extraction is done, it's time to access the data. So as mentioned, all the members of the study team who need access to that data and the study PI would complete our annual privacy training. So that's an online course with several quizzes. It takes about 45 minutes to complete. The data are accessible on our remote secure environment we call Citadel. You'll need access to the data or you will access the data through the remote desktop connection while being connected to the DAO network or DAO VPN. This also requires the person accessing the data to have a DAO net ID, but if you don't already have one, we can request one for you. When connected, it looks like a regular Windows desktop, but there's no internet connection and you can't copy and paste any text or numbers off of there. And when results need to be exported, you would need to contact the systems administrator who will vet the results to make sure there are no small cell sizes in there. And then you can perform analyses using SAS, Data, RStudio, or Python. And but if you need analysis to be done all within HDNS, we would just provide the study results or aggregate data for you. Next slide. So I've just added my contact information here and a link to our website for more information. And that's it from me. So I'll pass it on to Data MB. Thank you.
Thanks, Caitlin. So as Caitlin had, or Claire, I guess, had mentioned at the start of the presentation, my name is Megan Pike, and I'm the Data Transfer Coordinator at Data New Brunswick. Today, we'll provide an updated overview of the updated data access process, as well as data holdings at Data New Brunswick. Next slide, please. So our goal today is to provide everyone with an update on our rebrand, requesting data, accessing and transferring data, and hopefully, should time permit, we'll address any comments or questions at the end of the entire presentation. So after Spider. Next slide, please, Claire. So just a quick note about our rebrand. I feel like we've just been telling everybody about this last 3 months. So why the name change? For clarity and ease of recognition, Data New Brunswick is clear, accessible, and easy to identify. It reflects who we are today. Data captures the foundation of our work, and New Brunswick grounds us here in our province, which is really important to us. The rebrand also aligns with our role as a trusted partner for data-driven research in New Brunswick and positions us better for the future. So we've established ourselves here at home. So we want this clear identity sets the stage for a stronger national presence. But we want to assure you that we are, while our name is new, you can still count on us to be the same trusted partner to help everybody with your projects. So next slide, please. And thank you, Claire. So Afton, off to you.
Great. Thanks, Meg. I just posted a bunch of links in the chat so that now or after you're welcome to bookmark some of these and use them at your leisure. So thank you everyone for joining us today. Data MB facilitates 4 types of data access requests or 4 study designs. They're retrospective, prospective, successive, and multi-phase. Next slide. The first star type is retrospective. This is the most common one that we receive. It is for observational research that looks at data from the past, and it leverages existing data sets, those that are currently in custody at Data NB. Next up is the prospective DAR type. This is also observational, however, they will extend years into the future. So the cohort is followed to observe the outcomes as they occur. And just one note that Data MB can only grant access to data that is currently in custody. So for prospective projects, amendments will be required as new years of data are added to our platform. Thirdly, we have the successive DAR type. This is for those that conduct multiple research projects in a sequence. So there would be a series of sub-projects that follow an original request, and all would have the same scope, the same research question, the same methodology, but each sub-project would have one element that changes. So instead of having to start back at feasibility, each sub-project is treated as an amendment rather than going back. Next slide. Our 4th type is multi-phase. So we also facilitate mixed method research for projects that have both qualitative and quantitative components. And this is how the multi-phase comes in. So phase 1 is when the collection of the primary data takes place, the qualitative component. And phase 2 is where the collected data is linked to administrative data. So that's the quantitative component. Connection with Data MB to start phase 1 is crucial to ensure that adequate consent information has been prepared for the participants, for those whose data will be collected. And an initial REB is required for this phase to allow the researchers to actually engage with those participants and collect their data. However, before approval will be granted, the UNB Research Ethics Office must confirm that DataMB has been consulted and the project is feasible. Come to us first. Researchers will then come back to DataMB when they're ready to begin phase 2. And that's when they're going to want to link the collected data with the administrative data. And a second REB will be required from UNB during the processing of phase 2 to approve the linkage. Next slide. Okay, the best place to start is the DataMB website, and it contains all the information you need. As I said, I gave you some links. And just one note of caution about our website, because we're still new into this rebrand, some of the embedded documents may still have our former logo on them, so they will be replaced. And in the coming weeks, you will see new refreshed forms on the website. Next slide, please. This is a quick look at our website on the data access side. On the left-hand side, you can see there's many useful links. Today, we're focusing on data access, so it'll be the data access page that we're looking at. And here you're going to find a guide to the data access request. This is a one-page overview of our whole approval process. There's also links to the feasibility request and the data access request form, commonly known as the DAR. And also below the 2 links for the forms, you'll see little carrots. And if you click on those, you will have expandable explanation of each of these steps in the approval process. Next slide, please. Okay, so all projects start with a feasibility. The feasibility form is where you tell us a high-level overview of your project. Once received, a review is done to assess if your project is something we can help with and if we have the authority to provide access to the data that you will need. DataMB has 3 public partners through the MSSU who also review the feasibility request, and they provide a public perspective on the project. So their feedback is also included in the feasibility results. So we can go to the next slide, please. The first portion of our feasibility form, this is just the navigation screenshot. It's still being perfected, I'll say, before we can upload it to the web. So we just have this for a screenshot today. So the first portion here, it provides instructional information. The next is where you're going to identify if it's a multi-jurisdictional request. And if so, we ask that you connect with the Data Access Support Hub, or DASH, via the Health Data Research Network. And DASH will engage you to determine which projects or territories are in scope of your project and to arrange an intake meeting. The form then moves on to ask basic project information, title, funding, if DataMB analytical support is needed, and the use of patient-public partner engagement. And we encourage all of our principal investigators to contact the MSSU Patient Engagement Coordinator for information on this valuable service. The form then asks questions that will inform the 5 SAFEs: safe data, safe people, safe projects, and safe outcome, or safe output, sorry. And these 4 SAFEs then inform the 5th SAFE, which is safe setting. So at present, DataMB only offers on-site access. We don't have remote services. And our physical trusted research environment, or TRE, is secure. It's locked and only accessible to those who have completed administrative safeguards and those who have approved data access projects. We are working on offering remote service. So once remote service is operational, that safe settings feature will become more into play, and there will be guidelines on who can access the data, where and when they're allowed to. So just one quick note that if the feasibility request indicates that Indigenous data is required, DataMB will also ensure that engagement with the proper communities have taken place. Those communities will also be invited to participate in the reviews of the project. And DataMB is committed to respecting and adhering to the First Nations Information Governance Center principles of OCAP: ownership, control, access, and possession. Next slide. The DAR provides an in-depth overview of your project, and the overall purpose of the DAR is to limit use and disclosure of the data so that only what is needed will be accessed. In accordance with privacy principles, We can only provide access to what are necessary to answer your specific research questions. Access is to be limited to only those in your team who need it. Next slide. So the first portion of the DAR also provides instructional information, then goes into the PI's affirmation of our terms and conditions, and continues on with the basic project information, title, funding, use of analytical services, confirming all of those. And then following the same format as the feasibility form, the DAR will then ask questions to inform the 5 SAFEs, which is safe data, safe people, safe projects, safe output again. And the same thing for the 5th safe settings that will come into play once we have a remote access being functional. Next slide. When the DAR has been submitted, 5 approval steps must take place. The next few slides will take a closer look at each of these. Next slide. So the first step of the DAR approval is an institute review. This is an internal review of our DAR by select Data MB staff to ensure everything is in order. If needed, a meeting will be arranged to discuss the results directly with the research team. During this time, the research team is advised of any edits that may be needed and of the mandatory administrative safeguards. Next slide. The second step of DAR approval is the Data and Research Committee, which is similar to Data MB's, or to, I shouldn't have said that, which is the same pretty much as Nova Scotia's Data Access Committee. This is a meeting between the data business owners and custodians known as the DBOCs, Data MB, and the research team. The public partners who reviewed the project at feasibility are also invited to participate in this meeting. The purpose of the meeting is to allow the research team direct access to the DBOCs and vice versa. And it also provides the public partners with a chance to see how their feasibility comments were incorporated. During the meeting, the research team is asked to provide an overview of the project, and the DBOCs can ask questions about the project and advise on helpful tips pertaining to the data. And our DRC is scheduled the 3rd Friday of every month. Next slide. The third step of DAR approval is the Preliminary Ethics Review Committee, or PERC. Following DRC, the research team is asked to send their final version of the DAR, their UNB REB application, and any other supplementary documents to Data NB, and the PERC is then initiated. The PERC is a review of ethics and privacy considerations only. If any issues are noticed, they are raised with the PI, and once everything is ordered, a PERC package is prepared and sent to the UNB Research Ethics Office by Data NB on behalf of the PI. The PI is also CC'd, so they're aware of what was sent and when it was sent. Next slide. The fourth step of the DAR approval is the REB approval. So upon receipt of the PERC package, the UNB REB coordinator puts the project in a review queue. All projects are reviewed in the order that they are received, and the chair of the UNB REB will issue their findings to the PI directly via email. They'll be provided the REB number and the expiry date. And if any issues are raised, nothing does proceed until they are been addressed. Once UNB REB approval is granted, we ensure that the budget is confirmed and that the research team has completed their administrative safeguards. Next slide. The final step is the data access agreement. Data MB will send a draft DAA to the UNB Office of Research Services with the DAR attached. The Vice President Research will review and sign the DAA on behalf of Data MB, and then it's sent back to Data MB, and then we send it to the PI for signature. Once the DAA is fully executed, a welcome letter is sent, and a request is also sent to the database administrator to ask that the project folder and the user accounts to be created. The Data MB database administrator will contact the PI once the folder is ready, and at this point the project is active and analysis can begin. So you will only need to contact data services again if an amendment is needed or once the results are ready for dissemination. Information on amendments and data vetting, dissemination are all available on our Data MB website. Thank you for your time, and now I'm going to hand things back over to Megan to discuss the data.
So today I'm just going to briefly cover the data transfer process as well as the type of agreements that may be involved when transferring data to the Institute and the types of data that we hold in custody. Next slide, please. So Data New Brunswick has always been committed to supporting our data partners throughout the entire data lifecycle. That's from initial engagement all the way through to ongoing data stewardship, data destruction. We look after your data from sort of beginning to end, however long that is. The Data New Brunswick Privacy Office completes privacy impact assessments on any incoming data, whether it's for project or for platform. And that part of that process is ensuring that they're transferred and held securely. Next slide, please. So data transfer process, all data transferred to Data New Brunswick trusted research environment must follow the approved and standardized process. It's the same as remote data access is not yet possible. Data cannot be transferred to Data New Brunswick via a cloud or electronically. So program data is either mailed to me securely or you get to come to the lab and I can show you how anticlimactic it is and we hand deliver it very, very dramatically to our data administrator. So hand delivery of an encrypted and password protected USB drive facilitated by me or data are sent via express courier. That's sort of where we're at right now. The accompanying crosswalk file, which would be the file that would allow the data to be linkable, is hand delivered much the same way to the database administrator who initiates the intake process. This involves verifying that the data we receive matches the agreement that we facilitated, that the variables outlined are correct, concise, and are providing the information that was indicated as such on the agreement. Next slide, please. So we have what I call three main data agreement types here at Data New Brunswick. We have the master data sharing agreement, as well as the individual disclosure schedule that's coupled together. We usually draft those for DBOCs who are going to transfer more than one platform data set to Data New Brunswick. It just allows us to create an easier relationship out of the gate and sort of allowed for a much more streamlined process for any additional data that come from that same data business owner. The data sharing agreement, we use that more often for project-specific data sets or maybe one-offs. And then the information manager agreement, which is one that we really don't use that much anymore, but that's if you're going to transfer some data that's not linkable. So we have three data types: platform data, project-specific data, and information manager data. Next slide, please. So you can visit the website below. This has our list of all of our current holdings. It also has variable descriptions, variable list, anything that we may have that you may want to know. I will say that the website is updated in accordance with intake. So sometimes there is a delay, and that's just us ensuring that the data we transfer is actually accurate and correct. Next slide. So I'll just do a brief sort of overview of our holdings. Currently, we have over 130 active platform data sets available for linking across our platform. Each data set is maintained on a schedule outlined in the data sharing agreement, and our goal is to have everything be as current as possible for an external user to view on the website as soon as possible. Over half of our data platform holdings fall under the health category. We have the DAD, Vital Statistics Provider Registry, as well as over a dozen holdings from the Canadian Chronic Disease Surveillance System. That creates a really large opportunity for data linking and working with both of provincial health authorities in New Brunswick. We have Horizon Health Network as well as Vitality Health Network, and we have successfully transferred emergency room data, IV oncology data, and a variety of clinic data from both sites. So we're able to say we have province-wide health authority data. Categories such as demographics, immigration, and environment, they make up the remainder of them, but there are categories that are growing sort of as we grow. So keep an eye out for sort of big changes in our upcoming presentations. We do have a couple sort of in the pipe that we're really excited about that we'll definitely be wanting to talk about more. So if you have any questions, next slide. Please let us know. We are available for project consultations. Sort of everybody that Afton and I talked about, we all work very closely together. So that's sort of what we're after. We want to answer everybody's questions as quickly as possible and get your project approved. I think, Claire, if you want to just click quickly through the last three, I'll just sort of, so these are our socials. Feel free to click whenever you would like some more additional information. Next slide. You can contact us at these addresses. We've tried to sort of break it down because we want you to get to the person you need as easy as possible. So you can find those there. And then the last slide. Thanks for your time. Over to you, Robin and Alex at Cider.
Okay, so it's our turn now. My name's Robin Kidd. Claire's already introduced me. I'm a senior research scientist with the Center for Health and Community Research, and within this role, I'm also the manager of the Secure Island Data Repository at UPI. So like the other MSSU data repositories, we also have an acronym that we commonly use to refer to our data repository, and that's CIDR. Next slide, please. So for today's talk about accessing data in the Maritimes, Alex and I are going to briefly talk about two different data access paths that are available when you access data from CIDR. We'll start by talking about accessing data from PEI, followed by some information about the pathway for projects that want to access data from two or more different provinces or territories in Canada. So you've already heard quite a few details about accessing data from the Nova Scotia and New Brunswick data centers. And since most of our processes are very similar and we have detailed info available on our website, we're going to try to avoid repetition. So Alex and I will focus on a few main points about our data holdings and services at CIDR instead in the first part of our presentation. So if you're interested in more detailed step-by-step information, you can look on our website or you can contact us. Next slide, please. So CIDR has a small team, and this is it. So it can be quite a challenge to describe our roles. We all wear a lot of hats, both in our CIDR and our CHCR roles. And here you can see our official CIDR roles on this slide. And there's more info on our website. But within our staff, we have researchers with various expertise. So that includes epidemiology, biostatistics, patient and public engagement, inclusion, diversity, equity, accessibility, psychology, veterinary science, environmental health, health geography, patient navigation, and believe it or not, a lot more. We also have experience between us working in different settings with a variety of partners, so including academia, government, and community organizations. And while CIDR provides access to quantitative data, we also have a lot of experience supporting research that uses mixed methods. So no matter what you're interested in, don't be shy about reaching out. So due to our limited numbers, we don't have dedicated staff for some of the more specific roles that the other data centers have discussed. And our day-to-day roles even vary, as we often kind of jump into each other's shoes when someone else is busy or on leave. So it's good that we have overlapping experience. So for these reasons, we have one single email address. And so the best way to get in touch with us is that centralized address. And from there, we'll make sure you get in touch with the right person at the right time, and we'll provide you with the information you need. Next slide, please. So the idea for CIDR came from the formation of the MSSU in around 2013-14, as the SPORE support units were being set up across the country with a focus on data platforms and services. And so CIDR was funded through CIHR, funding from the PI Department of Health and Wellness, and in-kind support from UPEI. And in the early days from ACOA, who set up the physical infrastructure. So since those early days, the project has been funded through the MSSU, and more recently with the help of Health Data Research Network Canada, so financial and in-kind support for starting up our operations and now just for multi-regional health data use activities. So we're a pan-university research center and we manage CIDR. And we're aligned with the UPI Office of Research Services under Dr. Marva Sweeney-Nixon. So we're well positioned to provide research support and CIDR services to a wide range of researchers from across campus. And our role is to act as a data custodian under PEI's Health Information Act, and that defines a research data repository as a specific type of custodian who acts on behalf of different data providers like Health PEI. And so Health PEI, as a data provider, has signed a master data sharing agreement with CIDR and has transferred several master data sets to us with an agreement to transfer regular data set updates every fall. And so I'll now pass this presentation over to Alex, who will start off by giving you some additional details about CIDR's data holdings.
Okay, thank you, Robin. So here's a high-level overview of the data that CIDR currently holds. I'm showing here the administrative health data holdings that we received from Health PEI, as Robin described, our provincial government data provider. As you will see on the screen, there are 4 main data holdings. Caitlin described some of them already. So, for example, the discharge abstract database, the National Ambulatory Care Reporting System, FirstNet, and physician billings. These contain de-identified information about people's encounters with health services in the province, and they are also linkable at the patient level by a patient ID, which is assigned by Health PI prior to sending the data to us. In the interest of time, I won't describe what each of these data holdings contain, but there's a link to the page, to this page on the slide, so in case you would like to review the information a bit later. And what is not shown on this slide is the publicly available area-based socioeconomic measures that CIDR also holds, mainly from Statistics Canada. And these are data holdings like the Canadian Marginalization Index, the Canadian Index of Multiple Deprivation, the census profiles, the Index of Remoteness, etc. We are still working on the documentation for those, but they will be posted very soon. There will also be more details added in the coming months about the administrative health data as we continue to work on the data checks and documentation. Next slide, please. So as we are the newest data center in the Maritimes, we are still in the process of building our data repository. And the next data holding we're planning to receive is the patient. This data holdings contain valuable demographic and geographical information about those who have had an encounter with the healthcare system in the province. So this is a critical data set for pretty much all future projects. There are also other data sets that are in progress and that we hope to obtain in the future. Caitlin already talked about the CLSA and the Atlantic Path, for example. We tend to prioritize which data comes next based on our capacity here and the capacity of our data providers, and to draft the data sharing agreements, to incorporate the data providers' requirement, to prepare and document the data, etc. So this takes a little bit of time. So we try to prioritize based on capacity. And we also prioritize based on researchers' interest through the data requests that we receive. Next slide, please. So for every project at CIDR, data can be accessed on-site only. We don't have remote access yet. There are also several requirements that need to be fulfilled before accessing data, including the MSSU privacy training and the CIDR security training and orientation. Those who apply to access data at CIDR are typically academic researchers and graduate students. Each research team member who require access to the data need to be listed on our data access application form. CIDR staff will prepare the data for researchers. We also provide analytical services if needed. And similar to the other data centers, our services at CIDR are based on a cost recovery basis, which is determined during each data access application. And currently, data is available to researchers from academic institutions for research projects, but in the future, we hope to extend analytical services to non-research organizations for research purposes. Next slide, please. So our processes for accessing data are very similar to Nova Scotia and New Brunswick centers, as we try to align with the other maritime provinces as much as possible. So for example, we have a research consultation meeting, a data access application, a REB, privacy training, etc. So in the interest of time, as Robin mentioned, I won't repeat all the steps, but you can find them on our website, which is the link is provided on the slide. Yep, so next slide, please. So I would also like to highlight the first step of the data access application process, which is the free initial consultation with our team, which can be booked by emailing us at cider@upei.ca. So during this consultation, if a researcher already has a question in mind, we will discuss it with them to better understand their needs. But having a fully formed research question isn't needed. We can also discuss their research idea and help refine it or connect them with other researchers who can provide guidance or with whom they may wish to collaborate. We will help determine what data or analytical support they need and whether we are able to provide it. So we will discuss our data availability and limitations. And finally, we will also provide guidance about the data access process and provide information about the data access fees. So overall, we put a lot of emphasis on relationship building, especially in the initial project stages. And then we try to tailor our support to what the researcher needs. Next slide, please. So here are a few useful links and contact information to stay in touch with us. I will pause here and pass it over to Robin again, who will talk about multi-regional data access.
Okay, so I'm back. So now I'm going to switch gears for the next section and talk a bit about what to do when you have a project that involves more than one province or territory. So even though I'm the one that's presenting this information this time around, all of the presenters here today are also involved in pretty much everything I'm going to talk about in this section. So everybody else, please feel free to jump in anytime if you have any relevant info or experience or you want to add anything. So first of all, let's think about multi-regional research and why it might be important. It can be important for a lot of reasons, including assessing trends and variations across Canada, validating study results or algorithms in different provinces, getting a better representation of the Canadian population or the maritime population in your research, studying rare disease, or assessing impacts of different provincial policies and interventions. So in the past, any multi-regional administrative data project would require researchers to communicate separately with each data center. And historically, the maritime data centers, and up till now it hasn't been us, so it was Nova Scotia and New Brunswick, have worked together to facilitate these types of projects, as they always have worked closely, as we have, due to their MSSU roles. But what some people might be less aware of is that our data centers are now also part of a pan-Canadian network called the Health Data Research Network Canada. And that features a data access support hub that can provide centralized support for multi-regional data projects. So I'll say a bit more about how HDR in Canada and the Data Access Support Hub, or DASH is that acronym, works in a few slides. But first, I'll show you two quick summary slides for the maritime data centers that show how to get more information about accessing data from each of them and a quick comparison of some of the data holdings we have available. Next slide. So we realize this is a bit of a cluttered slide, but we realize that sometimes we move a bit quickly through our slides in our first three presentations since we're trying to share a lot of info. So, and there was a request for more of a summary slide from the last webinar. So here's a summary slide we put together in response to that request, and it shows kind of a high-level overview of where you can go to find out more about the data access processes and links for each of the centers. So it'll give you a good starting point if you want to take a photo or a screenshot of this slide. So even though all three centers have slight differences in our processes and forms, we all share the same basics. Like we have the detailed data access application forms that you've heard about. There's reviews to pass, feasibility, privacy, data access committee, and ethics reviews. We all have patient-public partners involved in our processes. Anyone who wants to use our data centers has to go through the same MSSU privacy training before a project begins. And we all have staff who are more than happy to help you with the data access processes. We're always looking for ways to increase the efficiency of both our single province and multi-province projects. And so that means that forms and processes are modified as we identify ways that can happen. So we're always looking to improve. Next. So this is just a very high-level overview of some of the data sets that are available at our data centers. There's quite a few details that still vary between these data sets because they're just general categories, including timelines and specific variables, and you would have to reach out to each center to confirm. But despite the limitations, we thought this visual might be a useful guide to start thinking about what data sources the different maritime data centers might have in common to answer research questions that apply to multiple maritime provinces. So the previous presentations already talked about some of the details of several of these data sets, and I won't go into any more. Quite a few of our MSSU and HDR in Canada working groups are doing work to improve different aspects of multi-regional data use, and that includes work on data compatibility and harmonization. And that type of work is really detail-oriented and time-consuming because of all the different differences, but we're all committed to continuing this work to try to better enable multi-regional data research, especially across the maritime provinces. Next slide. So now I'll go back to giving you a bit more information about Health Data Research Network Canada and their role in facilitating multi-regional data access. It's a distributed pan-Canadian network that was created with the mission to bring together people and organizations across Canada for transformative and world-leading multi-regional health data access and use. So it was established recognizing both the strengths of our individual organizations and the barriers that researchers face when they try to conduct multi-regional research. Next. So in addition to being full MSSU partners, all of the MSSU data centers are also member organizations of HDR in Canada, along with, you can see, several other organizations here. It's a really big benefit to be part of a network when you can draw on so much expertise, and it's very, very supportive. So it's been a great learning experience. Next. And HDR in Canada has lots of initiatives. It's a very busy slide. But if you look on the left, one of the main initiatives was to create the Data Access Support Hub, or DASH, to develop and improve services to support data access across Canada. So it's basically a one-stop service. It was launched in 2020 for researchers who require data access from 2 or more of HDRN Canada's member organizations across Canada. So Health Data Nova Scotia, Data New Brunswick, and CIDR are all member organizations, and so are some pan-Canadian organizations like CIHI and Statistics Canada. So the DASH team offers step-by-step guidance throughout the data access process and facilitates communication between the research team and each data center involved in a request. Next. So DASH has developed streamlined processes, resources, tools, and other solutions to support this kind of coordination. But it's important to remember that DASH doesn't hold any data itself. Instead, it helps researchers access data that is still held by the individual data centers that are members of HDR in Canada. And the reason I'm emphasizing this is that many researchers hope they'll be able to access data from individual data centers and then pool the data together into one larger data set that they can then analyze. But each province and territory has our own legislation and policies regarding data access that we need to follow. And this usually means that data can't be moved or pooled with data from other regions. Next. So for those of you interested in conducting this type of research, DASH supports this centrally coordinated path. This is a high-level diagram that outlines the main steps in the data access process, but I won't go into details here. I just want to quickly highlight one small aspect of this process that lots of researchers have found very, very valuable. In step 2, there's a little checklist item that says meet with DASH representatives. So to bring this step to life, and a lot of people on this screen have seen it happen, what this means is that DASH coordinates an online meeting for researchers to meet at the same time with representatives from all the data centers that they request data access from for their project. So this gives both the researcher and the data centers a chance to ask questions back and forth and clarify the project details, data access, availability issues that could impact the project's feasibility before it's assessed. And we've all participated in many of these intake meetings, and I never get tired of seeing the researchers' look of amazement as we all pop up in our little Zoom boxes from across the country, like sometimes 12 different boxes to have a chat with them at the same time. So even experienced researchers just really see the value in that. So that's kind of like a massive consultation. So it's quite a nice feature of DASH. Next. And this just highlights some of the other ways that HDR in Canada and DASH can support the research. And since many researchers aren't aware of some of the online resources, I'll quickly go through some of my final slides. I see the time is short, so this will be super quick. Next. So all of these resources and inventories are available from the website that I have here. It's a centralized data access request form, data assets inventory, algorithm inventory. A key resource here that's also useful for single province research studies is that they have guidance on wording for informed consent forms. So if you have a research study and you intend to link your study data with administrative data, it's a downloadable guide that explains things you should consider, provides suggested text. So it's quite a useful tool. Next, it's definitely worth a browse through that website. And here's one example of the regional requirements pages that's accessible on that website. Next. And now I'll just give you a brief look at what's contained in the Dash Data Assets inventory. And this is where you can search for data sets that might be relevant to your study. So you can see we're all in this inventory, and you can search it by putting in keywords, selecting filter categories to say what region you're interested in data from, different data very broad data categories currently being reworked, and the site that holds the data asset. And I've highlighted our 3 centers there, or you can combine the 2 approaches. Next. So if you wanted to look for emergency visits and PI residents that you can access through CIDR, these are the 3 you would do. And then you can see that the NACRS dataset appears that we hold. So you click on the NACRS, next, and then it takes you to a page with high-level information about the dataset. So you can see there, you can kind of dig in a bit more, learn some more about the collection period, different hospitals, things like that. So yeah, if you want more specific information, again, you have to go to the data center, or you can go through the Dash intake process and participate in those meetings and the communications. So this inventory is currently being revised by one of our working groups to be more user-friendly. So if you do have a look at it and you have any suggestions, send them our way and we'll make sure it gets back to the algorithms and harmonized data working group people. And finally, a new set of resources that has been put together is about distributed analysis. Because I previously mentioned Dash can't provide access to pooled data or in a central location, but the Dash team can facilitate conversations and suggest things and analyses that can overcome the limitations. And distributed analysis is one type of method that you could consider. I don't have time to go through it. But basically, each data center involved in the study has to harmonize their data sets, run the same analytic code, and then they would share their summary results, so regression parameters, with an independent coordinating node. So even though you're not pooling your data, the final results are within 2 decimal points of what it would be if you were actually physically pooling your data. Next. So if you want to learn more about it, there's lots of resources online, fact sheets, glossaries, comprehensive FAQ. And I'll stop there. And I hope I've given you some helpful ideas about where to look and who to contact for more information about multi-regional data access. And next slide, just pop this slide up one more time in case anyone missed it earlier and wants to quickly capture website info. Thank you.
Brilliant. Thank you so much to all our speakers. I will also leave this slide up just for another minute or 2. I'd like to open the floor to any questions. Feel free to pop it in the chat or raise your hand. And also if any of the speakers have any final thoughts they'd like to share. And while I'm giving everyone a chance just to type, I'm going to be popping a link to our evaluation survey in the chat as well. It's always very helpful to hear feedback and any questions and suggestions that anyone has. Michael, I'll pass the floor to you.
Thank you so much, and thank you to all the presenters for all the wonderful information that you've all presented. Personally, secondary data analysis is an area that I'm very much interested in. I'm actually moving towards that direction, and I have to admit sometimes it can be intimidating to understand where to start. And I appreciate how you were detailed about how to access and the support that's available to researchers that are interested in accessing this data. My personal challenge has always been knowing which data is available. For instance, I was thinking about a research question, but I wasn't sure where or whether the data is available in the first place. So I personally appreciate the fact that there are consultation services that people can subscribe to and then get to know what information is available. So my question would then be, what are there any specific criteria you need to meet to be able to be eligible to access the data? For instance, do you need to be a professor, or do you need to be currently affiliated to an institution to be able to maybe access the data, or can an individual on their own have access to those data? Thank you.
So for HDNS, anyone on the study team can access the data as long as they go through all the correct steps for accessing the data. So things like the privacy training and signing agreements and things like that. So yeah, I don't know if anyone else has insights into that.
Same for New Brunswick, as long as everybody's completed all the administrative safeguards, it's fine for them to access the data. We are not remote, so you do have to come to New Brunswick or hire our services, and then we would do the analysis for you. And typically there would be an institution kind of behind you as the PI versus being just an individual. There is the terms and conditions and liability issues for accessing the data that you need to consider.
Great, thank you very much. And just seeing that we're just past 1 and wanting to keep it to our hour mark, I know we have a couple other questions, but I would direct you to the websites, and there's also contact information for all of our speakers that will be shared along with the evaluation survey, if you wouldn't mind directing those questions there afterwards. So just say a final thank you to our speakers and to everyone for attending. We really appreciate your support in this series, and I hope you all have a wonderful afternoon.